I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel. Today I'm going to talk about gallbladder stones. Please do subscribe my channel and press bell icon button. Gallbladder stones are hardened stones from digestive fluid in the gallbladder. Gallbladder is a small pear-shaped organ on the right side of human abdomen just beneath the liver. The gallbladder holds a digestive fluid which is called as a bile that is released into the small intestine. Gallstones vary in size from as small as grain of sand or as large as the size of golf ball. Some people develop one gallstone. Some may develop more than one gallstone. Some patients require surgical intervention. If person is not symptomatic, then no treatment required. So what are the common signs and symptoms of gallbladder stones? As I mentioned, gallbladder stone may cause no symptoms. If gallstone lodges in bile duct, then it causes blockage, and due to this blockage, sudden and rapidly intensifying pains in the upper right portion of abdomen, sudden and rapidly intensifying pain in the center of abdomen just below the breastbone. Sometimes there is also back pain between shoulder blades, pain in the right shoulder, nausea, vomiting, and if there is any infection, then fever as well as rigors. So there are two types of gallbladder stones. One which is more common, cholesterol stones. They are yellow in color, contains undissolved cholesterol and other components. Other type of gallbladder stones are pigment stones. They are dark brown or black, contain much bilirubin. So what are the common causes of gallstone formation? If bile contains too much cholesterol, normally bile contains enough chemicals to dissolve cholesterol excreted by liver. But if liver excrete too much cholesterol, then bile can dissolve. The excess cholesterol may form into crystals and eventually into stones. The other common cause of gallstone formation is if the bile contains too much bilirubin. Bilirubin is a chemical that is produced when our body breaks down red blood cells. Certain conditions cause liver to make too much bilirubin. For example, if someone is suffering with blood disorders or blood diseases, or liver cirrhosis, or repeated biliary tract means gallbladder infections or common bile duct infection. Also there are chances of gallstone formation. If gallbladder is not emptying properly due to any defect, birth defect, or any surgical complication, some people are at risk of developing gallstones. For example, females, if person is more than 40 years old or overweight or obese, not doing enough exercise, eating rich source of cholesterol or fatty diet, or they are not eating enough fibrous diet, or there is also the family history of gallstones formation. Diabetic person is at risk of developing gallstones. Some blood diseases, for example, sickle cell anemia or leukemia, or if someone lose weight rapidly or quickly, or if someone is taking oral contraceptives, or any liver disease such as liver cirrhosis, so they are at risk of gallstone formation. So what are the common complications due to the gallstones? Infection of the gallbladder, which is also called as cholecystitis. So whenever gallstone become lodged in the neck of the gallbladder, then This causes inflammation of the gallbladder. If gallstone blocks CPD, then the common complication, sign and symptoms are jaundice, severe pain, infection. If the pancreatic duct is blocked, then there is also inflammation and infection. A pancreatic duct is a tube that runs from the pancreas and connects to the common bile duct just before entering the duodenum. So pancreatic juice flows through this pancreatic duct. There are also chances of gallbladder cancer. So how gallstones are diagnosed? So the diagnosis is based on the clinical examination, sign and symptoms, and history of the disease. Then doctor will do some tests. For example, ultrasonography. That is very good test, abdominal ultrasonography. So ultrasound will detect gallstones and how many are there, and if there is any infection, inflammation. Blood test will be done, for example, different laboratory tests as well as blood culture. A few more tests will be done, for example, endoscopic ultrasonography. So in this test, doctor passes a thin flexible tube that is called as endoscope through the mouth and through the digestive tract, and then they check gallstones. Several other imaging tests are done, for example, computerized tomography or magnetic resonance cholangiopancreatography or endoscopic retrograde cholangiopancreatography. So these tests are done, and during this procedure, if gallstones are found, so the gallstones will be removed. In treatment, if person is not symptomatic, gallstones are not causing any problem, then no treatment is required. Sometime surgeon will remove the gallbladder if there are repeated formation of gallstones. So this procedure is called as cholecystectomy. Without gallstone, person will live normal life, food can be digested. Some medications are also used to dissolve gallbladder, but they are required for months or years of administration. If there is a infection, then infection is treated with antibiotics, pain is controlled with painkillers. So how we can prevent gallstone formation? Skipping meal is not a good idea because it increases the risk of gallstone formation. If you want to reduce your weight or lose weight, so lose it slowly. Eat more fibrous food, eat more vegetables, fruits, and whole grains, and always maintain healthy weight, because if you are overweight or obese, then you are at risk of a gallstone formation. Thank you very much for watching this video. If you have any question, please write down in the comment section. I will answer all your queries.